are you? My name is Shirley, nurse practitioner student. Is it okay if I do a full HTTassessment on you?
Yes.
Okay. So we're first going to start just a general inspection of your skin. It looks nice and moist, warm to touch, temperature-wise. Okay, let me see your nails, please. I'm just going to check for capillary refill. The patient has good capillary refill. And let me check your toes real quick, please. Thank you. You can just keep your shoes off of the exam. Okay, so patient has overall great skin temperature and turgor and good capillary refill. So now I'm going to start with your head assessment, and then I'll move on down to your feet, okay, later on. So just by looking at you, you have obvious facial symmetry. Now I'm going to move on to test your sensory nerve, that's trigeminal nerve number 5, okay? So I'm just going to take this off diagonal. Give me 1 second. Okay, and if you can close your eyes, please. You're going to let me know if you feel it.
Yes. Yes. Yes.
Okay.
Yes. Yes. Yes.
Okay, so nerve number 5 is intact. Now I'm going to move on to take a look at your head and your scalp. Okay. So I'm just going to take my hands and just have a light feel. Okay. So the head and scalp don't have any outstanding lesions or weird bony formations that are abnormal. I'm just going to move on down to your sinuses, okay? And then you'll let me know if you feel anything, okay?
No. No.
Okay.
No. No.
Okay. So I'm going to move on to the temporal arteries. Just palpate them. And they're nice and strong. Okay. Now I'm going to also assess for nerve number 7, the facial nerve. Now if you can close your eyes tight for me. Good. And try to open them. Alright, good. Now just look at me and smile. Okay, frown. And then puff out your cheeks. And try to poke. Very good. Okay, you can release. Okay, so now we're going to go ahead and palpate the lymph nodes and also inspect the throat and the patient's neck. All right, so just look up for me a little bit, okay? And then turn to your left for me. Good. There's no bounding pulses that I'm seeing here, and then turn that way. Okay, patient's neck looks good. All right, now you can go ahead and face the camera for me. Okay, so you just tell me yes or no for pain, and I'll list out the lymph nodes that I'm touching, okay? Okay, pre-auricular?
No.
Okay, post-auricular?
No.
Okay, tonsillar?
No.
Okay, occipital?
No.
Submandibular?
No.
Submental?
No.
Okay, cervical?
No.
Okay, now we're gonna move down to the suprascapular.
No.
Okay, now I'm just gonna palpate for your thyroid and your trachea. Okay, and now swallow for me, please. Okay, very good. So on palpation, both lymph nodes and the thyroid are smooth and supple, no signs of tenderness, and the trachea is non-tender on palpation as well. Okay, so I'm also going to check for spinal nerve number 11, the spinal accessory nerve. So I'm gonna have you please shrug your shoulders. Okay, thank you. And then turn your hand against my hand. Okay, and now the other way. Okay, thank you. So cranial nerve number 11 is very much intact. Now begins the portion of the eye exam. I'm going to first start by looking at the patient's eye structures. patient has white sclera and pink conjunctiva. There are no signs of inflammation. Also, just by looking around the eye structure, there's no any discharge or anything that could signal inflammation or infection. I'm now going to move on to take my pen light, and I'm going to check the patient's direct and consensual conductivity as well as light reaction. Okay. If you could look straight ahead for me, thank you. Okay. Are you okay? Okay. So pupils are equally reacting to light. The first time I flashed the light was for direct response. The second time that I flashed it was for consensual response, so I was looking at how both pupils were reacting. I'm now going to test your extraocular movements, which will be cranial nerves 3, 4, and 6. So if you could please follow my pen light. Okay. I'm just observing if there's any nystagmus, and that's absent. Okay, good, thank you. All right, so now I'm gonna test for accommodation, and as the object moves closer to his nose, the pupil should be a little bit smaller. I'm gonna flash my pen light to help me a little bit. Okay, and the patient's pupils are getting smaller as expected. So now we're going to also check for confrontation, cranial nerve number 2, and then tell me what you see, please. Okay. And then
What?
all right, good. Thank you. So now I'm going to take my ophthalmoscope and I will check for the patient's red reflex. Okay. So I'm going to use the RRR and LLL formation. So I'm going to go on the right side, use my right hand to hold the tool, and check the patient's right eye. You can look ahead for me, please. Very good. And I'm going to use my left hand to hold the tool and look in the left eye. Look ahead. Okay, good, thank you. All right, and this ends the eye portion of the exam. Okay, so first I'm going to start by looking at the patient's outer ear structures, and there seems to be no outstanding inflammation. Before I use my otoscope, I'm going to palpate and ask the patient if there's any pain in the outer structures. Okay, good. So I'm just gonna go in and check, hold the pin up and back. Okay, so I'm observing for grayish white to clear tympanic membrane with a 7 o'clock cone of light, which is as expected for a normal clean tympanic membrane. Okay, and the outer structure looks good. Do you feel any pain? Okay. Okay, so patient once again, clear tympanic membrane, 7 o'clock cone of light is present. Okay, so now I'm gonna check for any kind of hearing loss. I'm gonna first do the Weber test, that's the sensory neural hearing loss. And I'm just going to, you take my timing fork here, and I'm going to activate it. And then once I do that, I'm gonna put it on top of your head. And then you're gonna tell me if you hear it on just one side or both, okay?
Both.
Okay, good. So there's no loss of sensory neural hearing. Okay, so now we're going to do the Rennie test. I'm going to tap the tuning fork again, and then I'm gonna first put it to your ear, and then back here to a bony prominence, okay? Okay, which one was louder?
Next to my ear.
Okay, good. good. So evidently the patient has no loss of conductive hearing or sensory neural. I'm going to now take the same ophthalmoscope, and I'm going to look at the patient's nose and mouth. Now the patient has, the nasal structure looks great, no obvious deviation there. So if you could tilt your head back, please. Okay. And one more. Thank you. Alright, so there's no nasal polyps or septal deviation obvious, and both the patient's olfactory bulbs are nice and pink, no sign of inflammation. Okay, now we're gonna move on to your mouth. We're just gonna take a look at your lips. They look good. There's no cracks or anything that could signal dehydration. Can you open your mouth for me, please? Okay. And then stick out your tongue, please, and say ah.
Ah.
Okay. Now wiggle your tongue. Okay. And then I'm just gonna take a look here. Okay. All right. And then swallow. Okay. Very good. So cranial nerves 10, 11, and 12 are all very much intact. The patient's teeth they look nice, no cavities. The oral mucosa is nice and moist and pink. Okay. So we will now move to the portion where we check the patient's chest and lungs. I'm first going to start by inspection. Okay. And I'm just looking at the patient's breathing. It's nice and even. There's no signs of use of accessory muscles. Okay, good. Now if you can please turn around. All right. Okay, so inspection once again, and now we're going to move with palpation. And I'm first going to do tactile fermenters to make sure that there's no consolidations that I need to look out for. Okay, now say 99.
99. 99. 99. 99.
Okay, good. Now we're going to do percussion. Okay, good. All right. So now I'm going to go on and auscultate. And then we check for thoracic expansion. Take a deep breath for me. Okay, one more. Okay, thank you. Deep breath. Okay, good. Now I'm going to please have you say E-E-E.
E-E-E. E-E-E. E-E-E. E-E-E. E-E-E. E-E-E. E-E-E. E-E-E.
Okay. Now you're going to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. So last thing you'll do for me is you're going to whisper 1, 2, 3. Thank you. So aside from auscultation, what I also did was check for consolidation with bronchophony, egophony, and whispered pectoriloquy. So now while I'm here, I'm going to check for costovertebral tenderness. I'm just going to do a quick kidney punch and you let me know if that is okay.
No. No.
Okay, good. All right. So now I'm going to have you turn around. All right. So I'm just going to palpate the chest area before I take a listen to your breath sounds. Okay. And no pain when I touch it, correct? Okay. Sorry. Deep breath for me. Okay, very good. So the patient's lungs are very much clear to auscultation, both posterior and anteriorly. Okay, so now we're just going to move on for your cardiovascular exam. I'm going to listen to your heart sounds and the characteristics, and then we're going to move on after, okay? Alright, so I'm just going to first take a look at your carotid arteries. Can you turn to your left for me? Good. I'm just going to palpate as well. Okay, and now turn towards me, please. Okay, good. So I'm going to have a listen while I'm here too. Then you can go ahead and sit down, please. I'm first going to use my diaphragm to listen to my patient's heart. Okay, so straight for me, please. So I'm going to move this back. Okay, so aortic, pulmonic, Eric's point, tricuspid, and mitral. I'm going to use the bell now. Aortic, pulmonic, Eric's point, tricuspid, and mitral. Okay, I'm here because I want to palpate the point of maximum impulse. It's very palpable, but it's at the level of the fifth intercostal space in the clavicular line, which is where you would hear the mitral valve. Okay, so now I'm going to have you please lay down. You can put your head towards this way. Okay, good. All right, I'm going to use my diaphragm once more to listen to my patient. Aortic, pulmonic, Eric's point, tricuspid, and mitral. Now while I'm here, I'm going to have you turn to your left, please. I'm going to try to listen for any mitral stenosis. Turn your body for me. Very good. You can leave that. And there's no sign of mitral stenosis in this patient. And then you can go ahead and sit back up if you want. Alright, so now I'm just checking the distal pulses, radial. Okay. Brachial. Okay. Posterior tibial. Good. Dorsalis pulses. And now posterior tibial. Okay. While I'm here, I want to check for any kind of edema, of which she doesn't have any. Okay, good. And this ends the cardiovascular portion of the exam. So now starts the portion of our abdominal exam. So while the patient is laying down, I'm going to first inspect the patient's abdomen. Uncross your arms for me, please. Thank you. Okay. All right. So the abdomen is nice and symmetrical, flat, as expected. Okay. So now I'm going to take a listen to the patient's bowel sounds. So the patient's bowels sound are nice and loud, so I won't need to listen for the full 5 minutes. I'm going to now auscultate the patient's aortic artery. Okay. Now onto the renal arteries. Okay, now the iliac arteries. Okay. All right, while I'm here, I'm going to also palpate for the femoral artery, which is more in the groin area. I'll do over the patient's clothing. Okay, nice and present. Okay, very good. So now I'm going to palpate for the aortic pulsation, which should be about 4 centimeters. And his seems to be at right about 3 centimeters. Okay, so I'm going to now percuss. And I'm going to start by percussing for the liver scan. Sorry. Are you okay? Okay. The liver was about, looks like at 10 centimeters, we're going to say. Okay, now I'm going to go ahead and do a light palpation, and also as I palpate, I'm going to end up palpating the liver and the spleen, as well as the patient's kidneys, which will be all be done on deep palpation. So right now we're just doing light palpation. Do you have any pain? Okay, good. Now for deep palpation. Now I'm going to palpate the liver. Exhale for me. Okay, and now inhale. Are you okay? I'm sorry. Okay. Alright, so the liver is, well, almost pretty much under the rib cage on his right side. We're gonna palpate the spleen. And exhale. Okay, now inhale. Okay. Alright, good. Now I'm going to move on to palpate the kidneys. You're just gonna put one hand under his back, and then you're on this angle here, and then exhale. Okay, now inhale. Okay, very good. Okay, and now exhale once more for me. Okay, inhale. Okay, very good. Thank you. And this ends the abdominal portion of the exam. Okay, now we will begin our portion where we do the musculoskeletal exam. So I'm going to first start with neck range of motion. So I'm going to have you, you can actually face the wall for me, please. Thank you. Alright, so you're going to flex your neck forward. Okay, good. And then you're going to extend your neck back. Good. Any pain?
No.
Okay, good. Now go ahead and tilt your head to the right. Okay. And then tilt your head to the left. Okay. So that's lateral, right and left lateral flexion. And then you're going to turn your head, just turn your head only to the right. Okay. And now to the left. Thank you. And those are both left and right lateral rotation. Okay, so now you're going to do it against my hands, okay? Okay. Now, go ahead and push against my hand, excuse me. Okay, push against my hand. Okay. Now, tilt your head, and then push against my hand. Good. And one more. Good. And then try to turn your head this way. Good. And now that way. Alright, thank you. So now we're going to move on to spinal range of motion while I have him standing. Now go ahead and just put your arms out straight to your side. And you're going to bend forward. That is spinal flexion. Okay, you can stand back up. Do you have any pain? Okay, now go ahead and then go backwards for extension. Good. Okay. And then you're going to just tilt your upper body to the right side for lateral flexion. And then do the same on the left side, please. Thank you. Are you okay? Alright. And now you're going to only rotate your upper body. Very good. And then once more on the left. Okay. Good. Alright. So also while you're standing, we're going to do hip extension. So you can hold on to the bench if you need to. And then you're gonna stick your foot straight out. No, straight back. Sorry. Okay, good. All right, and now you're going to do the same for the other foot. Okay, very good. Okay, that's good. Thank you. All right, so if you could please face the camera again. All right. So now we're going to test for shoulder range of motion. All right. So I'm going to start with shoulder adduction. Okay, now you're going to take this hand and put it straight across. Okay. Do you have any pain? Okay, now push against my hand. Very good. For resistance, now one more time for adduction. Okay. Good. And then push against my hand. Thank you. All right. So now we're going to do, that was the crossover test. We're now going to do the apnea test. So that partially tests for short shoulder internal rotation. So if you can turn around, please. Okay. Now you're gonna try to take your right hand and reach your left hand. Very good. Good, yes. And now you can go ahead and try to do the other hand. Okay, very good. All right. And now, turn around for me, please. Okay. I am going to do abduction that I left out. So you're gonna raise this arm, this right arm, okay, and then now slowly drop it. Okay, I'm gonna raise this one now, and then slowly drop it. Very good. Now try to lift against my hands. Okay, good. All right, and now you're going to do external rotation of your hips. So you're gonna, there you go. And then just do one hand at a time, please. Okay. And then now you're going to try to push against my hands. Okay. And once more against my hands. Okay, very good. Okay. We're now going to move on and do the super spinatus strength. So we're going to do the soda can test first. So if you could please take your arms out 90 degrees and then invert. Okay, and hold your arms at 90 degrees. That's good. Yes, that's okay. All right, and I'm going to try to raise my hands. Okay, good. And then now we're going to do the nearest test. So I'm going to put my hand on his scapula, and then I'm going to raise your arm. Do you feel any pain?
No.
Good. Okay. So the patient did not have any pain on either of those tests. So we can, this means that there are no supraspinatus lesions on the patient. Okay. So now we're going to do elbow flexion and extension. Okay. Now just flex your elbow for me. Okay, and extend. Good. And now go ahead and do the same for here. Good. And now try to push against my hands. Good. Try to push against my hands. Very good. All right. And we're going to now you're going to take your hand out and turn it up. Okay, and then now you can put it back down. That's supination and pronation of the elbows, and then go ahead and do the same here. Very good. Okay, you can rest. All right. Okay, we're going to now check for wrist range of motion. So I'm going to have the patient please put your hands out. Okay, now bend the wrist forward for flexion and up for extension. Very good. Now keep your hands straight. Now this will test for any ulnar or radial deviation, and the patient doesn't have any. Now we're going to move on to Tinel's sign. Relax this hand for me, and then turn this hand. Okay, you can relax it. That's okay. Any pain?
No.
Okay, good. Any pain here? Okay, good. Now onto Phelan's sign. You're going to turn your hand. Very good. Are you feeling any pain right here?
No.
Okay. So the patient doesn't have any sign of carpal tunnel at this moment. Now we're going to do finger range of motion. Put your hands out for me. Okay. Now your thumb, you're just going to flex it. And this one as well. Very good. And then you're just going to extend it. Okay. Now for abduction, you're going to put your thumb towards yourself. No, that's, there you go. Yes, very good. And now you can go ahead and touch your thumb to your pinky fingers. Okay, that is finger range of motion for abduction. Okay, now we can go ahead and move on to hip range of motion. Go ahead and lay back for me, please, sir. Okay, good. Okay, so you're going to go ahead and lift this leg towards your, lift the knee towards your chest, please. Okay, good. Release. And then once more now against my resistance. Okay, good. And now this one. Okay, release. And against my resistance. Okay, good. Okay, now you're going to take your right leg and swing it towards me. abduction. Okay, now if you can cross this leg over and keep it straight for adduction. Okay, now you're going to repeat the same movement with the left foot, abduction. Okay, good. And then try to cross over to knee. Okay, adduction, very good. Okay, now, okay, and you can go ahead and sit up. Are you okay? Okay. All right, now you can go ahead and swing this out. Good. So now we're gonna test for hip internal rotation. Just keep this knee as straight as possible and swing your leg inward. Very good. Okay. And now swing it outward towards me. Very good. And then swing this leg inward. Okay. And then outward. All right, good. So while he's sitting, we're gonna test for knee flexion and extension as well as for resistance. Okay, now flex your knees in. No, I'm sorry. Bend your knees in as much as you can. Okay, and the other one, please. Okay, good. Now, all right, now you can go ahead and extend your knees straight out your legs. Okay, good. Now, try to push against my resistance. Okay, and then now against my resistance. Okay. Okay, we're now going to test the patient's ankle range of motion. All right, so if you could flex both of your ankles up for me, that's dorsiflexion, and then point them down for plantar flexion. Now push against my hands. Good, and then push against my hands. Okay, good. All right, so now we're gonna check for foot range of motion. We're gonna check first the transtarsal joints of the feet. Okay, so I'm just gonna have you invert your foot. Okay, that's eversion. Okay, and now inversion. Good. And then inversion towards me, please. Towards me. Okay, eversion, and then inversion towards me. Good. And now we're going to check the subtalar joints. Okay, can you see the camera? Okay, so inversion and eversion. Okay, and then inversion and eversion. This ends the portion of this exam. Now you're gonna take your finger and touch my finger to your nose. Okay, good. All right, now close your eyes for a little bit and release your ankles. Good. Patient has obvious balance while sitting. Okay, now you can go ahead and stand up for me. Okay, now just put your arms out straight like so. Close your eyes. Okay, while I'm here, I'm going to test both for Romberg and the pronator drift test. So patient is standing nice and straight. There's no evidence of imbalance. Okay, good. And then there's no sign of any drifting. Put your arms a little bit closer. Thank you. All right, so there's no drifting of his head while he's closing his eyes, which shows that the patient has great balance. Okay, thank you. You can release. Now we're just going to do a quick walking test. So you can just walk straight from here to the edge of this cabinet here. Okay, and come back. Okay. Now you're going to do tandem walking, so heel to toe, same way. Thank you. Now come back. Now you're going to walk on your toes. And then you can come back walking, but on your heels. And now this ends our full head to toe assessment exam.